Maharashtra continues to top the states in both the daily number of deaths and cases. Over 55,000 new cases coming in from that state alone. And just look at the condition of what's happening in the Beed district. 8 bodies cremated together in that area as cases and deaths continue to spike and medical infrastructure completely overburdened at this point. Purva Chitnis joining us on the phone line. Purva, we're looking at these very disturbing shots. Tell us who these people were, if we know, and is this regularly now the protocol that all the COVID positive patients who lose the battle against the virus are cremated together? Why is this happening?
Well, in fact, you're absolutely right. Those visuals are completely disturbing, and this has come from Beed district, and it has come from Ambazogai city, which is near Parli Taluka. And this is the a condition of Ambazogai where 8 people were cremated together, and in fact that district, that city in the last 1 week or so has seen 500 odd cases come up. So definitely this is the picture across rural Maharashtra where the health infrastructure is completely overburdened. And as far as those pictures and that particular case is concerned, well, in those there's just one female body and rest are male. And in fact, this was one-off case where all of them were cremated together. But if this continues, go in the coming days, then we might be unfortunately seeing such visuals, on an almost everyday basis if this continues. So definitely this second wave, the number of cases in Maharashtra are going up. And so far, before April, in fact, the state has been saying that, the death rate is low and it's not the sign of worry yet. But now, in fact, in the last 1 week or so, we've seen that the deaths are also going up every day. Yesterday itself, 297 deaths from Maharashtra, 32 of them from Mumbai. So it is not just Mumbai or Pune that we have to look at, but also these interior districts where health infrastructure is completely overburdened. There's just one civic hospital, not many primary healthcare centers, and that is the reason why there's a delay in going to the hospital. People are not getting beds, and we are seeing how that is one of the primary reasons why people are also losing their lives. So definitely a picture we need to keep a track of, especially in rural and interior Maharashtra.
In fact, that's been a trend that we've seen in the second wave, isn't it? Where we are seeing tier 2 cities actually get infected even more, something that wasn't the case last time around. Let's take that forward with our guest. We've got Dr. Hemant Deshmukh from KEM Hospital joining us from Mumbai. Thank you so much for your time. Dr. Deshmukh, just want to begin by understanding what exactly is the condition of hospitals right now in Mumbai to begin with. We're obviously looking at Beed and we're looking at smaller towns emerge as the hotspots this time around during the second wave. We also saw reports that the oxygen is running out, blood supply running out, doctors extremely fatigued with over a year of just being inside PP suits and trying to deal with the patients. What exactly is the current position in smaller towns and Mumbai? If you could take us through that first.
Good morning, Sonal. The situation at the ground level is very grim. As you understand, the number of cases have been increasing for the last almost 4 weeks. And the lowest figures that we had in the second week of February, we have almost 10 times the number that we had in the second week of February. Wow. Right now, KEM Hospital itself has 228 patients. Most of these are critical patients, and we take only critical patients. The bed augmentation in the city of Mumbai has reached its maximum. We have enough number of vacant beds right now for mild and moderate diseases. That is, we have these field hospitals, or what we call as COVID centers, the jumbo facilities for treatment of COVID patients. And most of these patients, we still have beds. And what we require right now is enough supply of oxygen as well as medications to treat these patients who are being wheeled in. A stark difference between the cities and the smaller towns of Maharashtra is that the numbers are so overwhelming that patients are coming quite late in the stage of the disease. They are coming at a time when the oxygen requirement goes down. The virus is so rampant in the interiors as well as Maharashtra that the transmissibility and the effectiveness of its sting is so high that it almost always causes a serious condition within presentation of a day or two.
Okay.
And such overwhelming is the facility that all these patients who are thronging to the COVID centers are definitely coming with oxygen levels of 70% and less, and a stage where their CT scan findings are showing extreme cases of ground glass appearance. What we typically talk about.
What obviously is a takeaway from this is the fact that the smaller towns don't have the medical infrastructure. So by the time they make it to the bigger centers, they come in a very serious condition. What I'm also gathering from you, Dr. Deshmukh, is the fact that a lot of younger people also now are serious. It's not like home quarantine alone is being able to fix them. Is that what you're telling us as well?
Yeah, we analyzed the number of cases from the start of the year 2021. And what we have seen is the patients who are coming right now are from the age group of 35 to 55, more than any other age group. Though less than 35 are also getting affected, children are getting affected. And this is a very alarming sign for all the citizens of India that this disease is not the disease of the elderly. This disease is not the disease of patients who have comorbidities, but anybody who are, slightly on the obese side, patients who are moving around in the city of Mumbai or Maharashtra, a free run for them is definitely a recipe for inviting the virus into their throat.
Right, these are the earning members of the families actually who've been going out, who are seen in the trains and metros, etc. And that's what's really leading to the spread. And ironically, this is the chunk which is not open to vaccines just yet, something that really is the need of the hour. Thanks, Dr. Deshmukh, for your perspective over there.